We wanted to cover both aspects, some minor technical aspects of imaging for the pulmonologists, respirologists, cover the major topics relating to disease, and then cover safety and considerations related to incidental findings. Well, the role of imaging has been increasing in pulmonary medicine for several years. In some countries, such as the US, we now are moving toward lung cancer screening, which means a very large increase in CT imaging. And then other modalities are really hitting their stride in terms of functional imaging that may be coming forward to disease management very soon.
Now we have novel imaging techniques where we really not only can see lung structure but also function. So we're moving more into function, into biomarkers, and into predictive biomarkers to predict patient outcome and to monitor disease. And I think in this monograph on imaging, we're really sharing that knowledge.
It is increasingly used for more accurate and confident diagnosis, to the extent that people tend to be more reliant on imaging rather than resorting to traditional methods of taking an accurate history and performing careful examination. We tend now to believe that imaging is the final arbiter, and potentially we overemphasize the importance of imaging and forget the clinical context in which we're performing the investigation. So as a consequence, we tend to utilize imaging potentially more than is appropriate, and there's a lot of interest in the use of resources in clinical practice with the purpose of avoiding over-investigation and over-diagnosis and, of course, over-treatment.
Well, I think the role of lung cancer screening in the context of at least the US and possibly coming toward Europe, although we will see depending on trials, which really has changed the face of how we're thinking about imaging versus even spirometry, let's say, in practice, where there's now randomized data supporting an imaging modality that isn't quite there for spirometry yet. And then as we move to other imaging modalities, there are very rapid evolution in functional imaging, which isn't maybe quite, it's moving toward the clinic, but should be there in very soon.
Cystic fibrosis is a very hot topic. Here also radiation is an issue because cystic fibrosis is a disease of younger people, and monitoring these people with cystic fibrosis without radiation, using MRI, is a very hot topic, and we're grateful that Professor Skaucha's group from Heidelberg is doing this chapter.
We're also using imaging to such an extent now that we are investigating patients in a way that is possibly inappropriate. We're performing so much imaging now that we are finding that a lot of these images don't identify what we were expecting to find on our investigation, but are revealing things that were unexpected, and that has significant consequences in how we manage the patients.
Because there are so many emerging novel techniques and novel technology, we need to get the word out there, what is available, but at the same time we need to standardize. So there are many new biomarkers and prognostic markers or monitoring markers, functional markers of the heart and lung out there. We need to sort of form guidelines how to use them and not overly use them and not add additional tests to make the healthcare system more expensive. I think this monograph really is a key to understand imaging and help the physician to use imaging wisely.